I came back.
How's Jasmine?
She's good. She's doing better. She's
She's
back from
on
the
her
debate.
Monday.
Yes.
Oh, good.
She'll be
Okay.
back from the debate, I think.
Good. Oh, good. Okay, in Atlanta. Okay, great. Good.
Senator, can I just ask you a quick
Hi.
question? We're in Nevada, and can I get your take on decriminalizing sex work and the equality model in that realm?
Yeah, I mean, listen, first of all, my background is that for years I specialized in crimes against women and children. And on the issue of human trafficking, I have seen too many instances where women are disproportionately criminalized, incarcerated, abused in the system. And I believe that it should be decriminalized. I have, in my history, many years ago, well over a decade ago, focused on an issue where people called it teenage prostitution. I said, no, let's talk about sexually exploited youth. These kids, mostly girls, many of whom came from the foster care system, many of whom were runaways, who were being bought and sold, and when they were arrested as quote-unquote teenage prostitutes, they were being put in juvenile hall and criminalized. And I said, no, there needs to be a different approach. And so I was a leader in creating a safe house for these girls, saying that they should not be criminalized and we should understand the nature of what's going on with them. So that's my background on it, and that's why I take the position I do.
We'll go to Jeff right here.
Hey, hi.
Good to see you, Senator. Obviously, you're speaking to so many people within our communities of color today.
Yeah.
Your message to Las Vegas, to North Las Vegas, in terms of how you create economic justice, how you create housing justice here in this community. How do you do it?
Well, first of all, you have to understand how people are living and understand that almost in 99% of the counties in the United States, a minimum wage worker cannot afford market rate for a one-bedroom apartment. You got to understand that we're looking at, in Nevada, that so many families were devastated by the foreclosure crisis. I know it because I work closely on the issue with then Attorney General Catherine Cortez Masto. Let's look at what we need to do to invest in affordable housing around, first of all, renters. So my plan is for families or individuals who are paying more than 30% of their income in rent plus utilities, they'll get a tax credit of up to $6,000. It is about saying that we need to help people with affordable housing. So I have a whole plan that's about investment in billions of dollars in states like Nevada to build affordable housing and to partner with folks like our friends in the building trades, understanding that they have some of the best apprenticeship programs, and so they can help us focus on the communities that need affordable housing to also build the skills so that those communities can help build the housing that they'll live in.
Senator,
can we get your reaction to Mayor Bloomberg apologizing for endorsing stop and frisk policies? Do you think the timing of that is opportunistic?
Well, I think he was right to acknowledge that stop and frisk was a horrible policy that essentially, it explicitly profiled, in particular young men of color, in particular black men. And, I know, because I have family members who have had that experience over and over again, and what that does to traumatize people. It is one of the most degrading things that somebody can experience, to be pulled over and told to drop to their knees, put their hands on their back, when they've done nothing. And so he's right to apologize.
Do you believe the apology, Tim?
Senator, we've got a debate coming up in the next few days. How do you typically prepare for these debates? And is there anything? Fair enough. Don't we all?
I believe the power of prayer.
But is there anything that you're going to be doing different? Like anything you've learned from the past debates? Anything you want to do better?
I'm going to just be present.
Senator, you talked about your healthcare plan out there today. Do you think that eliminating private insurance altogether is especially punitive in communities of color and African Americans? And is it your belief that African Americans are specifically skeptical of Medicare?
I believe that government should not be in the position of taking away people's choice, especially on one of the most intimate and personal decisions people can make, which is about how to address their healthcare needs. So my plan does not get rid of, nor does it seek to get rid of private insurance. It, however, does bring insurance companies and hold them accountable for what they've been doing for years, which is jacking up the price of healthcare. So in my plan, there will not be an ability of them to charge copays and deductibles, which have for many families, been the barrier to people actually getting health care. But we can't take choice away from people, and I heard from too many people that, that said, Kamala, don't take away my choice, but I require the insurance companies to compete. They're gonna have to compete, and those that are able to compete will be in the program, and those that can't play by our rules will not be in the program. Tara?
Could it be especially punitive to African Americans, though?
Here's the thing. If you're going to talk about specific populations, and in particular black families in America, we know that there is across the board disproportionate outcomes in terms of health care, and mostly to do because there's no access to health care, be it affordability, be it because there are a lack of hospitals and service providers in the community, be it because there is a lack of attention to the health care needs, disproportionate health care needs of the black community. For example, high rates of diabetes. Let's talk about maternal mortality. I have been a leader in the United States Senate in recognizing that black women are 3 to 4 times more likely to die in connection with childbirth than other women. And by the way, that has nothing to do with their socioeconomic status or educational status. It literally has to do with the fact that when that black woman walks in a clinic or a hospital or a doctor's office, her words about her condition are not taken seriously.
Senator Harris, good morning. Hi. The Buttigieg campaign, excuse me, Mayor Pete Buttigieg has been using a stock photo of a Kenyan woman in promoting his Douglas Plan for Black America. What is your reaction to that, and do you think it's further proof of the disconnect he has with African Americans?
I'm sure someone agrees that was a big mistake. I mean, he's gonna have to answer for that. I don't have words to describe that.
And what do you think it says about him appealing to black voters?
Look, let's be clear that the Democratic nominee has got to be someone who has the experience of connecting with all of who we are as the diversity of the American people, and is going to have the ability to speak with and speak to the issues that impact everyone. My experience is that when you have actually had the experience of working with folks, you have a better ability to represent. And so each nominee is going to have to speak to their experience and speak to their, therefore, capacity and ability to be relevant to the diversity of who we are as a country, because the Democratic nominee has got not only going to have the ability to go toe-to-toe against Donald Trump, but is going to have the ability to unify the party and the country. And you can't unify folks if you don't understand who they are and their specific needs, and the right that they have to be represented based not on a stock photograph, but who they actually are.
All right,
So
so
do
that's
you
all
think-
we're
do
gonna
you-
do.
Do you think that Iowa and New Hampshire should be